Multiple Sclerosis Today. This is a dedicated audio channel inspired by the comprehensive book, Living with Multiple Sclerosis, a guide for patients, families, and caregivers. This podcast is designed for anyone touched by multiple sclerosis, patients, families, caregivers, and healthcare professionals, offering clear, compassionate, and actionable guidance for every stage of your MS journey. Now, here's your host of the Multiple Sclerosis Today podcast, Andres Ortiz.
Hi, friends, and welcome back to Multiple Sclerosis Today. If you're living with MS, love someone with MS, or just trying to understand this disease better, I'm really glad you're here. Today, we're going to talk about something that's often pushed into the shadows: mental health in MS. We talk a lot about walking, numbness, MRI scans, and medications, but we don't talk enough about sadness, fear, worry, anger, or the feeling that I'm just not myself anymore. If you've ever thought, why am I crying so much? Why am I so scared for the future? Why can't I think as clearly as before? Does anyone actually understand what this feels like? Then this episode is for you. You are not too sensitive. You are not too emotional. You are a human being living with a hard, real disease that affects your brain, your body, and your heart. So let's walk through why we need to talk more about mental health and MS. What is happening in the brain and how common it really is. And what can you do to feel supported and less alone? Well, first off, what do we mean by mental health and MS? So let's start with the basics. Mental health is about how you feel emotionally: happy, sad, worried, or calm. How you think, focus, memory, planning, decision-making. How you handle stress and relate to other people. In MS, mental health is not just a side issue. MS affects the central nervous system, your brain, and your spinal cord. That means that it can touch the parts of the brain that control mood, helps you think clearly, and manage stress and fear. So when someone with MS feels depressed or anxious, it is not just a reaction to having a chronic illness. Yes, the stress of living with MS matters, but research shows that up to about half of people with MS will have depression at some point in their lives. Around 1/3 to almost half will experience anxiety. These numbers are much higher than with people without MS. So this means mental health symptoms are not rare. They are not just in your head in the dismissive way people sometimes say it. They are part of how MS affects the brain and life, the quiet emotional weight of MS. Now let's talk about what actually feels like. You start to grieve for the old you. When you get diagnosed with MS, your life often splits into two parts. You have before MS, when you might have felt in control of your body and your future. After MS, when things can feel uncertain and a little scary. You might grieve the old you, the you that could walk for hours and hours without thinking about fatigue. Then the you who could run and hike and play with your kids without worrying about falling. The you who didn't have to think about MRI scans or lab tests or insurance battles. Grief is not just about death. It's also about loss of abilities, loss of roles, loss of plans. You see, you might feel sadness because of this. You could feel anger. Why is it me? Denial. Maybe it's not too bad. Fear. What will it be like in 10 years? Those feelings are normal. They are not signs of weakness. They are signs that something important has changed in your life. Everyday stress can pile up. On top of everything else going on, everyday stress can be harder with MS. Getting dressed may take longer. Planning trips might mean checking for ramps or elevators, bathrooms. You might worry you'll have a flare up at the wrong time. You might have to cut back on hours at work, which can affect your money and self esteem. And over time, all that stress can build up. Even if you're doing okay physically, emotionally, you may feel very tired and worn out. See, that's makes it easier for feelings to be misunderstood. And one of the hardest parts in that many MS symptoms are invisible. Fatigue, pain, dizziness. And here's the good one, brain fog. You also have depression and anxiety. You know, people might say something like, but you look fine. You're young. You'll bounce back. At least it's not something worse. These are comments that may be meant to help, but they can do the opposite and they can feel invalidating. You might start to feel like no one gets it. No one understands. Maybe I should just keep quiet. That silence can make depression and anxiety worse. This is exactly why we need to talk about mental health and MS. So people know that they're not alone. And so families, friends, and doctors understand what's really going on. How MS changes the brain and mood. Well, let's talk for a moment about the science in simple terms, what MS does to the brain. MS causes your immune system to mistakenly attack your myelin, which is the coating around your nerve cells in the brain and the spinal cord. When the myelin is damaged, it creates lesions or spots that doctors can see on an MRI scan. These lesions are not always in the same place, and they can show up in a lot of different ways in areas that control movement, in areas that control vision, which will be optical neuritis, in areas that control mood and thinking. When lesions affect mood related areas like parts of the frontal lobe and the limbic system, excuse me, the brain's emotional center, they change. How easily you feel joy, how sensitive you are to stress. It'll change how well you control worry or panic. This means that depression and anxiety can be partly caused by the disease process itself, not just by life stress. You know, your brain uses chemical messengers like serotonin and dopamine to manage mood and motivation. When MS changes the brain's wiring, these chemicals can get out of balance. Some people with MS say, I don't have a reason to be this sad, but I am. Or I used to enjoy my hobbies, but now I feel numb inside. This is not being dramatic. This is what happens when the brain circuits and the chemicals get disrupted. We also have challenges, cognitive challenges, and what's known as brain fog. Okay. On top of the mood changes, many people with MS experience cognitive symptoms often called cog fog or brain fog, such as trouble concentrating, slower thinking, and trying to complete a process, forgetting words or appointments, difficulty in planning tasks or multitasking. These problems can be very frustrating and embarrassing. They can also feed into mental health struggles. You might avoid social events. If your thinking feels slow, you might feel, lack of a better term, you might feel stupid even though you're not. All of this shows how tightly physical MS, cognitive changes, and emotional health are woven together. It's all one big package. Why is this a big deal? Well, let's look at some simple numbers to understand how common this really is. Depression, research suggests about 1 out of 2 people with MS, around 50%, will experience major depression at some point. In the general population, it's closer to about 1 in 10 to 1 in 5. Anxiety disorders, like generalized anxiety or panic, may affect about 1/3 or more of people with MS, which is higher than people without MS. Cognitive changes. Studies are showing that somewhere between 40 and 70% of people with MS can have some form of cognitive difficulty during their illness. There's also the risk of suicide. People with MS have been found to have a higher risk of suicidal thoughts and suicide compared to the general population. Depression and hopelessness are major reasons. Large studies of thousands of people with MS have found that their overall quality of life scores are much lower than those with people with the same age without MS. And in some cases, the younger adults with MS reportedly have a quality of life similar to someone decades older who does not have MS. These numbers are important for 3 reasons. Number one, you see, they show that the mental health symptoms in MS are common, not rare. Number two, they show that this is a serious issue, not a small side effect. Number three, they help explain to doctors, health systems, and policymakers why mental health in MS deserves attention, time, and resources. Well, why don't we talk about it enough? If mental health in MS is so common and serious, why don't we talk about it more? Well, that's because of stigma and shame. Many people still feel that depression and anxiety are a sign of personal weakness. They think that if I were stronger, I wouldn't feel this way. I should be grateful other people have it worse. Or I don't want to be seen as complaining. But depression and anxiety are medical issues, especially in MS. They often get better with the right care, just as an infection gets better with antibiotics. Still, stigmas make people afraid to speak up. They may not tell their family. They may not tell the doctor. They may not even admit it to themselves. Then we have another issue of time pressures in medical visits. Doctors often have very limited time in each visit, so they focus on MRI results, relapses, new or worsening physical symptoms, and treatment decisions. If no one brings up mood or thinking, the doctor may not ask. This doesn't mean they don't care. It often means that the system pushes them to focus on the most urgent physical issues. Some clinics are now adding routine screening for depression, anxiety, fatigue, and cognition using short questionnaires. But this still isn't done everywhere. So what happens? The strong have to put on a face. We have to put on that strong face that we put on. Many people with MS feel that they have to be strong for others. They have to be strong for their kids. They have to be strong for their partners. They have to be strong for their parents, for their coworkers. They may feel guilty for needing help. They may say, I'm fine, even when they're not. And over time, this strong face can become a mask that is hard to take off. But every mask gets heavy after a while. So talking about mental health is a great way to gently set that mask down. I need support too, is what needs to be said by the person with MS. They need to be able to have that support. Now, here's some examples. Let's walk through a few simple situations. They're not one single person, but they are built from real patterns that are seen in studies and clinicians. Sarah is a working young adult. Sarah's 32 years old. She has relapsing remitting MS. She works full time in an office and she looks fine on the outside, but the inside, she's exhausted. She pushes through fatigue because she's afraid of losing her job. She starts making small mistakes. She forgets meetings, feels slower in conversations, and at home, she cries in the shower so her partner won't hear her. She tells herself, I should be grateful. I can still walk. She feels ashamed for feeling so sad. At her next appointment, the neurologist asks, how's your walking? Any relapses? Sarah responds and says, pretty good. But she doesn't mention the crying or the fear or the brain fog. Months later, she feels hopeless. And finally, she breaks down in front of the doctor. The doctor listens, screens for depression, and refers her to a therapist. She starts counseling, and the antidepressants slowly begins to feel more like herself. Talking about mental health changed the direction of her story. John, who's an older adult with progressive MS, John is 57, and he uses a wheelchair most of the time now. He used to love fishing and walking and working with his hands, but he had to retire early, and he spends most of the time at home and sees his friends less often than he'd like to. He feels like a burden on his family. And even though they tell him they love him, he starts thinking, what's the point? He doesn't want to worry his wife, so he keeps it inside. And when he finally shares his feelings in an MS support group, he hears, me too, over and over. He's realizing his thoughts are not weird. They are more common in MS, and the group leader encourages him to talk to his doctor. He's screened for depression, referred for counseling, and eventually enjoys rehab, which includes exercise tailored for his wheelchair use. His mood, his energy, and his sense of purpose slowly improve. And again, opening up made the difference. Let's talk about what you can do. You might not be able to change your diagnosis, but you can change how you supported or how supported you are. Number one, talk to your healthcare team. You have the right to say, hey, I've been feeling really down lately, and I'm not sure why. I'm finding that I'm worrying all the time. I don't enjoy things like I used to. My thinking feels foggy. So you ask, can we screen for depression or anxiety? Are there any therapists who understand MS? And are there any support groups that you recommend? Your neurologist might turn around and say, let me give you a short questionnaire and refer you to a mental health specialist or suggest medication or therapy. Now, depression and anxiety can get better with treatment. So you definitely want to be able to ask those questions. Consider therapy, which is counseling. Okay. Therapists, psychotherapists, and counselors can help you name your feelings, understand your thoughts, learn coping skills, and practice self compassion. A common type of therapy is cognitive behavioral therapy, which is known as CBT for short. It helps you notice unhelpful thoughts like, I am useless now, everyone else is better than me, and gently challenge those thoughts and challenge them, replacing them with a more balanced thought, such as, my abilities have changed, but I still have value and I still contribute in new ways. Therapy is not about fixing you, it's about giving you the tools to handle a hard situation. Medication and moods. Some people with MS, medication like antidepressants or anti anxiety medications help a lot. You see, they can balance brain chemicals, reduce constant sadness or worry, and make it easier to do therapy and daily tasks. These medicines are not magic and they are not for everyone, but they are worth discussing with your doctor. If your mood is very low on a consistent basis, or you've lost interest in most things, or you're having thoughts of hurting yourself, taking a medication for depression is no different than taking insulin for diabetes. It's treating a real medical problem. So talk to your doctor if you're having those situations. Movement and activity. You do not need to hit the gym or run a marathon. Gentle, consistent movement can help your mood. This might be stretching in bed, could be chair yoga, which has become very popular. Short walks with rest. Water exercises, do water aerobics. Some folks with MS find that extremely helpful because the body is weightless in water. Using a stationary bike if you're able. The physical activity increases feel-good chemicals. It improves your sleep. It reduces fatigue in the long run. And physical activity can release feel-good chemicals, improve sleep, reduce fatigue in the long run, and help you feel more in control of your body. Of course, you always have to ask your doctor or your physical therapist what is going to be safe for you depending on your stage of MS. Always consult your team. Another thing that we don't put a lot of thought to, but it makes a big difference, is sleep and your routine of sleep. Poor sleep makes depression, anxiety, and fatigue worse. You can support sleep by going to bed about the same time each night, limiting your screen time, your phone, your tablet, your TV before bed, keeping the bedroom dark and cool, and avoiding large meals or caffeine close to bedtime if possible for you. A simple routine, simple wake time, meals, movement, rest helps your body and mind feel safer and more steady. The other thing that can help a lot is social connection. Humans are social. We are a social creature. Even if you are introverted, you still need to have some connection. This could be one of those close friends that you text regularly, a support group, in person or online. There's a lot of online groups now that make it easier for those who have mobility issues, a faith group or community group, an MS organization program. There's one they have called CogniFitness, which is a great program that the National MS Society has. Hearing Me Too is powerful. It breaks the lie that you're alone. Self-compassion is so important because finally, be gentle with yourself. You do not have to be positive all the time. You do not have to earn rest. You're allowed to be sad and tired and angry or afraid. But self-compassion means taking and talking to yourself like you would talk to your dear friend. Instead of I'm falling, I'm going through something really hard and I'm doing my best. Instead of saying I'm lazy, my body needs more rest right now because of the MS, and rest is allowed. You want to understand and acknowledge what you're going through. Now, through all of this, we've talked about what you can do. Research and treatments are evolving, and the good news is that the medical world is paying more attention to mental health and MS, screening and quality improvements. Like some MS clinics are now including the screening programs to regularly check when a patient comes in for mood or fatigue, if you're too tired and you don't really understand why, cognition, having brain fog, quality of life. These are things that are really important. They are not side issues. These programs help doctors spot problems earlier and help sooner instead of waiting for a crisis. Disease modifying therapies, which are known as DMTs, and the brain medications that treat MS itself, can reduce the number of relapses and slow physical disability by protecting the brain from new damage. They may also help in protecting the thinking and the mood indirectly. There's ongoing research into drugs that better protect the brain's gray matter, treatments that aim directly at inflammation in the brain areas that are linked to mood. New approaches and hope it is right around the corner. Researchers are exploring more targeted immune therapies, ways to repair the myelin, lifestyle programs that combine exercise, mental health, among social support. All of this sends a clear message that mental health is now seen as an important outcome, not just an afterthought. This is why we need to talk about this more, the big picture. So why do we need to talk more about mental health and MS? Because it's common. Depression, anxiety, and cognitive changes are part of the MS journey. Silence does not match reality because it's serious. These symptoms can lead to isolation, job loss, broken relationships, even suicidal thoughts. Early recognition can save lives because it's treatable. Therapy, medication, social support, lifestyle changes can all help people with MS deserve the chance to feel better emotionally, not just physically, because it affects everything else. When mental health improves, people often sleep better, move more, socialize more, and take their medications more regularly. That can lead to better overall health. And because it reduces shame, the more we say this is real, it's okay to get help, the less alone people feel. Sharing makes it easier for others to speak up and say, yes, that's me too. I'm going through that. Because it guides better care and policy. Because when we talk openly, health systems are more likely to fund mental health services, support research, and design MS care that includes the whole person, not just a part of the person, the whole person. So if you're listening and recognize yourself in some of this, here are a few gentle steps that you can consider. Number one, tell a trusted person, a friend, how you really been feeling. Mention mood, anxiety, or thinking changes to your doctor at your next visit. Ask, is there someone I can talk to about this? Look up reputable MS organizations that offer support groups and education. Give yourself permission to rest without guilt. Try one small self-care action this week. A short walk, a phone call to an old friend or a trusted friend. Try journaling. Write down how you feel. Nobody has to see it, just you. And a few minutes of calm breathing. You don't have to fix everything today. You just have to take one step towards being kinder to yourself and more honest about what you're going through. Remember, you're not alone. Thank you for spending this time with me. Living with MS is hard. And it's okay to say that out loud. You're not too much. You're not broken. Your mood, your thoughts, your fears, your hopes, they all matter. Mental health in MS is not a side topic. It is the heart of living well with this disease. By talking about it more at home and in clinics, online, and in research, we make room for real healing, real support. If this episode spoke to you, consider sharing it with someone else who might need to hear that they're not alone either. Take gentle care of yourself today. And if you feel that this podcast has been beneficial to you or your loved ones in explaining your MS journey, please hit the subscribe button so that you can receive automatic updates and notifications on the upcoming podcast of Multiple Sclerosis Today. Now, if you have any suggestions on new topics that you'd like me to cover, drop me a line at multiplesclerosis@gmail.com. Thank you again for spending your time with me. And remember, live your best life with MS. Until we see you next time on Multiple Sclerosis Today. Take care and be well.